radiation oncologist and clinician scientist here at the London Regional Cancer Program. I treat prostate cancer as well as brain metastases and lung cancer here. I've been here for about a dozen years, and a big part of my research program revolves around prostate cancer and prognosis. So the ProCaRS database is a national research project coordinated here in London, but it has a national scope in Canada. And what it involves is collecting data from all over Canada in terms of radiation outcome and bringing it together to create one large database. The reason why we want to do that is to look at the outcomes of patients who receive radiation therapy for prostate cancer, and it allows us to do some analysis with regards to patients' prognosis. So the project did begin a few years ago, and the project started with a literature review, but essentially what happened after that point was that we decided to create the national database, and that was the phase one of the project, where various institutions from Canada, including in British Columbia, in Quebec, and in Ontario, pooled their data here in London, and we were able to start analyzing the data. We were able to collect almost 8,000 patients, which makes this one of the world's largest prostate cancer databases for research purposes. And the primary purpose of the first phase of analysis was to look at patient outcome, but also to look whether or not we need to adjust the risk categories of prostate cancer patients, which currently there are three. There's basically a low risk, intermediate risk, and high risk patient population. But we think that there may be more nuanced risk categories that help to better define what treatment patients need. Phase two is to basically take the database and try to mine it for information that helps us to figure out what factors do predict for good or poor patient outcome, and to the level of trying to predict for future patients. There's a couple of procedures that we use on a statistical basis. One is called a nomogram and one is called neural networks. But essentially both of these procedures try to predict the future based on the data that we have from the past. The funding specifically will be going to hire a research associate for the next year in order to help coordinate that research, and essentially to mine the data from the database to create these prognostic models that would go onto a website or onto an application of some sort. The project, in terms of impact on prostate cancer, is directly related to prognosis. We do want to have a better idea of how patients will do, as patients with good prognosis are probably best served with the treatments that they are already getting. Patients with poor prognosis may be better served with other additional treatments, and to try to predict which patient populations are going to do well and which ones don't, allow the clinicians, like myself, to better individualize treatment, but also to define new clinical trials in the future that may be of benefit to our patients to try to improve cancer treatment. Ultimately, the success of the project will be measured by the completion of the phase two project, which is to create these models and to have them in a more easily accessible media, such as, once again, a website or an application where clinicians and or patients can access the information. I'd like to thank Motorcycle Ride for Dad for their funding of this project. I'd like to thank the participants of the Motorcycle Ride for Dad as well for their participation that's been going on for many, many years. And hopefully the funding will help to move things forward with regards to prostate cancer research.